My name is Jessica Mitchum. I am a family medicine physician here at Colquitt Regional, and I work with the residency program. I'm on staff with them. I love teaching the residents and seeing my own patients over there. I actually went through the residency program as a resident, so I graduated from residency in 2019, and then after I graduated, I stayed on as faculty. So in all, I've been here, what's that, about 6 years. I'm from a small town in rural Louisiana called Mount Hermon. It's much smaller than Moultrie, and it's hard for a lot of people to believe that, but I think growing up, I knew from a young age that I wanted to be a physician. I was a preemie. My mom had me 2 months early, so when I was old enough to look at pictures and kind of know everything that was going on, I was like, oh, okay, I kind of want to do that. So initially I thought I wanted to do pediatrics, but later I realized in family medicine you can do a little bit of everything. So I knew from a young age that medicine was kind of what I wanted to do, and I just pretty much stuck with it and had supportive family members, mentors, teachers that helped guide me along the way. Back in April of 2022, I was diagnosed with diffuse large B-cell lymphoma, which is a type of cancer that attacks lymph nodes. I initially started having some vague symptoms that can be attributable to many types of cancer, like night sweats, weight loss, but I had recently had a baby, so I was like, okay, a lot of moms tell me they go through this night sweat thing or, hormonal changes. So, like I said, sometimes doctors are the worst patients, and so I just kind of, put it off of, oh, this is nothing. But then when I started to notice a lot of difficulty breathing, shortness of breath, extreme fatigue, I said, okay, I need to go get this checked out. And that's what led me to see my primary care physician, who's a family medicine doctor. She was able to, do some lab work, do some imaging, and that's when they discovered that there was a large mass in my chest, which was causing, the shortness of breath, basically pressing on my lungs. So she acted quickly with our oncologist here, our radiologist, to help me get the best care. So I am biased because I work here, and I do trust the opinions of my colleagues, but I also respect that my oncologist said, hey, once we figure out exactly what's going on, if this is something that I feel you need to go outside for treatment, then we'll definitely recommend that to you. And basically that made me say, okay, I trust this person, and they realize, okay, if there are limitations, then they will send me where I can be, well taken care of. But the fact that we do have a cancer center here in our community at this community hospital was extremely, extremely important to me, being that, I don't have to drive to Atlanta or, Florida to get my chemo and radiation. I can drive less than 5 minutes from my house and be well taken care of. That's very important to me, especially in a small town. I think that was awesome that I could be able to get treatment here. I had one of my husband's family members, who's a physician in the Atlanta area, was very, adamant about me coming to Atlanta to get my treatment, and this was before I even knew, exactly what the diagnosis was and the specifics or what type of chemotherapy I needed. And I think that she assumed that just because I was seeking care in a small town that we were not capable of providing good care here, and it's quite the contrary. I was very happy to tell her that I'm confident that I would be getting the best care, and I would frequently give her updates and just let her know how I was doing. But of course I'm biased because I work here, but I was very, very proud that I was able to get my care here, even in a small town. We're very, very capable and competent, and that made me feel really proud. Yes, I definitely would recommend any patient going through cancer who needs chemo or radiation therapy, go to the Edwards Cancer Center. Not only is the technology and the physicians are great and very knowledgeable, but the nursing staff, they took great care of me. They always made me feel comfortable during treatments. So I would highly recommend anybody who needs to have cancer treatment, seek treatment at the Edwards Cancer Center.